clearly we are recording it so members of the public can listen to it afterwards. And at this point, can I do the formal welcomes? First of all, can I formally welcome Jude? Jude, you have attended a number of governor's events, but can I formally welcome you to what I believe is your first full council meeting?
Thank you very much, Sheila, and I'm delighted to be here, and I'll be speaking to you all later.
Thank you, Jude. And can I say how great a contribution Jude is already making to the board and to the non-executive group. So thank you, Jude. And can I welcome a particularly warm welcome to Chris Lake. You have had a note from Anne outlining that we are starting on the board evaluation, board review process. And it's welcome to Chris, who is leading on that process. And Chris, a warm welcome. I don't know if you'd like to just show yourself on screen and just introduce yourself.
Well, I've turned my camera on. I'm not sure that you can see me, but I can see me looking back at me.
We can see you.
Hello, everybody. I'm Chris Lake. I'll be, as Sheila said, essentially doing board development, starting with a process that we call discovery. We will lurk, hopefully not menacingly, in the corner of rooms, observe meetings quite quietly. There's some other discovery processes that we have going on to find out how is this board working really well, and if it were to work even better, what sort of advice might we give it? So I'm going to go back on mute and let you carry on. Just ignore me. I'm not here.
But welcome anyway. Okay, I'm going to move into the main agenda. Can I ask, please, for those of you presenting papers tonight, can we take papers as read? Because otherwise we are going to be here until 10 o'clock tonight. And I'm quite sure you, much as you are enthusiastic about West Suffolk and committed, you probably would like to finish before then. So can I move into the main agenda? Apologies for absence. Can we take those as you read out, Anne, in the previous meeting? Thank you. Welcome and introductions. I think I've welcomed everybody already this evening. You are always warmly welcome. And I will say again, I regret that I can't welcome you in person. It was wonderful on the development day to be able to see people and chat to people and just have that exchange over coffee. I think, you know, the sooner we can get back to working like that, the sooner we will be more effective in the way we work. Declarations of interest for items on the agenda. Is there anything fresh that anybody needs to record? I'll take that as no. The minutes of the previous meeting, may I take those en bloc? I will pause a moment and see if anybody has any issues which they don't think have been picked up elsewhere. I see no hands up. Can we move then to the matters arising sheet, please? And sorry, my machine is on go slow. I think if we turn to those, if we look at the first item, this is the ward accreditation programme, which we were going to have an update today, but we will be getting a later update. The work is very much ongoing. And Helen, have you joined us?
Yes, I have, Sheila.
Helen, I don't know if you just want to comment, because you, as Chief Operations Officer, you've probably been closer to it than other colleagues.
Happy to comment, Sheila. It is something that is absolutely focused on delivering. However, she's also very, very clear that to make it meaningful, it needs to be done properly, not necessarily just quickly. But she's focused with the heads of nursing and working through what the structures would be, and it is becoming part of the thought processes for the heads of nursing as well, in terms of how we'll assess performance. So I'm afraid off the top of my head, I don't have a date from Sue as to when she thinks, but I'm absolutely sure that it is on their radar and is moving forward.
No, and I don't have a date, but I do know there's been a huge amount of work on it. Liz, you wanted to come in?
It's not about that, actually. It's about one of the other items to do with the date.
Okay, if we could move to the second page, then could we move to what is page 24 of convene? And you have 3 green items at the top. Was it one of those, Liz? Was it one of those, Liz?
Yes, it is. It's number 219. I'm just confused. We're going to ask the Freedom to Speak Up people to come in. It says early spring 21. Is that 22?
Yeah.
Yes. Can I comment on 2020? Because Liz and I, have talked at some length about this issue of awareness of the governor's role. And Florence, I know with your engagement chair hat on, you've also been involved in discussions. I think it's really important that we do highlight the governor role. And I think the green sheet is one way of doing it. So
yeah,
we
haven't got any further with that. I'm still waiting to hear back from James if he's there listening. We need to get together to sort it out. Thank you.
But the intention is very much there.
Yeah.
Okay, and the final 2 items on page 24 of convene are closed unless anybody has any questions on those or anything else. Liz, is that legacy hand? That's all right. That's fine. Okay, thank you. In which case, could we move to my chair's report? And I think the only thing that I want to highlight from it, just in introducing it, would be the recruitment of the chief executive, which is an ongoing process and in which we will engage the governors. There are a multiple number of conversations to have with a variety of stakeholders, because whoever is appointed into the substantive chief exec role will be hopefully the chief executive moving into the next 5 years, potentially the future systems, the new building, and therefore we need to look at what it is we need moving forward. And that is a big challenge, and it's a conversation we want to share widely with our stakeholders. And of course, you are the absolutely key ones. I'm not going to say anything else. I'm happy to take questions. I'm happy to say a little bit more about maximalisation if anybody wants to, although of course I can't share anything of the confidential nature of that. Liz.
Sorry, it's me again. I just wondered if you've got any information about I think it's called Vanguard unit that's at Ipswich. Is it called that? It's more to do with how we're coping with and it may be that Craig wants to pick this one up, coping with the backlog. And are our consultants involved in going over there? That's really what I wondered, if you could update governors on how we stand on that one, please.
Helen, shall I bring you in? I don't think you don't know the answers, Craig.
Yeah, I'm happy to respond to that. So, yes, it is called a Vanguard unit. It's a temporary theatre facility. It was based on the Ipswich site purely because there was nowhere to place a Vanguard facility on the West Suffolk site if you consider all of the other building work that is going on. So absolutely not ideal, but it was procured on behalf of the system. The arrangement was that we would have use of it from when it opened, which wasn't until the middle of August. There was a lot of talk about it before, but it wasn't available for use till the middle of August. We are using it through till the end of November for day surgery procedures. We are trying to do the simplest cases there, which basically means we're doing in the main local anaesthetic simple day case procedures, although there are some general anaesthetic cases happening over there. From the end of November onwards, the unit will move across to be manned by Ipswich to deal with some of their cases, and we will backfill any gaps if we can that they can't use. But it has been used for West Suffolk activity undertaken by West Suffolk clinicians up until the end of November.
Thank you, Helen, for that. Were there any other questions for my report, or shall we move to Craig's? Okay, in which case, thank you all very much. And can I thank the hardworking governors who have stayed engaged with so many things as in these rather difficult times, and where working is not very, working collectively and collaboratively is not always easy. Craig.
Thank you, Sheila. I'm mindful of the instructions to take the report as read, but there are just a couple of things, if you'll forgive me, highlighting, and that is to just provide some colour around the pressure that the organisation is under. So we have had some of our busiest ever days through our emergency departments during the summer. So where we used to see peaks in demand in winter, this year we've seen them in summer, and we are not alone. So that pressure on services is common across all areas of the health and care sector, whether that's primary care, mental health services in particular are coming under pressure, but also social care. And the need to work together has never been greater than it is now, and that is exactly what we are doing. What I would say is that none of us have a silver bullet as to how we will solve the problem of excess demand and not enough capacity as we get into winter. So there are a number of us around the organisation that are very worried about the entirety of the system. We will cope, but the real issue we've got is the quality of service that we always strive to provide, and that does get compromised when we get really busy. And that links to one of the other issues in my report, which is around maternity whistleblowing, which is exactly that. It's staff that had got to a position where on a consistent basis they weren't delivering the quality of service that they wanted to deliver because there weren't enough staff to deal with the demand that we were facing. I would say that it's really brave to write a letter that is in any way critical of your employer, but actually it's really important that people in the organisation feel as if they can say things that aren't always comfortable to hear, because that's how we will get better. So we don't know who's written the letter, and I couldn't care less who's written the letter, but we've generally thanked the staff who have taken it upon themselves to write to the press and to the CQC, because it's done from deeply held values that we would share. The only other thing that I would point out is around the continuing efforts we're having in the organisation to deal with the structural issues. So I've talked about some of the pressure we're under, and there are some unique factors that we're dealing with at West Suffolk, and that does relate to the structure. So not only are we dealing with demand that we're not staffed to cope with, but we're also moving staff and patients around the organisation to facilitate structural work, and that means people are often working and caring for patients in unfamiliar environments. So just I'm stressing the need for everyone to work together and to look after one another, and accept that there will be times when people get cross, they get angry, they say things they wouldn't normally say, and just to give people a little bit of latitude and recognise that actually deep down what we're trying to do is exactly the same thing. And it is sometimes difficult balancing. So Sheila talked about some of the really exciting things that we're facing as an organisation. So building a new hospital isn't something that happens very often. It's nothing. It isn't something that's ever happened in my career. So it feels to me as if this is a career-defining moment. So it's reasonable to get excited about that, but getting excited about the future while you're struggling to deal with the present is sometimes a difficult balance to strike. And so we're just acutely aware of that. It doesn't mean we should ignore the future, but just recognising the challenges that people are facing at the moment. Other than that, Sheila, I'm happy to, I can see a few hands up, so happy to take any questions.
Thank you very much indeed, Craig. And I'm deeply conscious of the huge pressure staff are under. And we need to deal with each other with compassion, with courtesy, with all those things. And it's always important, and never more than now. Becky, and then Carol, and then Robin and Jane.
Thanks, Sheila, and thanks, Craig. And my comment leads on from Sheila's actually. For adult care, I'm acutely aware of the huge pressure the whole system is under. In fact, it's been pretty relentless since before COVID, and I don't think we haven't had a dip in the pressure. But I don't know if it's something that you may not be aware of, but something that I know we've been talking to the comms team at West Suffolk Hospital, as well as Suffolk County Council comms team, to do some communication to residents with regards to managing expectations when it comes to using our services, and just sort of a bit like we're all in this together. We all want to do the best quality services as we possibly can, but you may just need to bear with us because of the pressure the system's under, or you may have a delay in some of your treatment. Of course, we'll provide urgent treatment where it's required, but just to manage some expectations and just to sort of say to people, bear with us. You know, we're doing the best we can. So I don't know if that's something that you are aware of, but I just thought the governors would be useful to know that we're going to be doing some joint comms as a system through social care and health, which I think is really important to show that we're in it together around managing expectations.
That's really helpful, Rebecca. Thank you.
I do think it is really important, Becky, and it is, so I am aware of that. I think what it's really important to do as part of that communication is to effectively signpost people. So not only to address expectations and communicate how busy we are and how constrained we are, but also to give people details of what the options are. So if you do have this condition, then this is where you can go rather than the emergency department. Or if you're thinking of calling social care, then this is what you can do rather than do that. So being specific about those communications, but our teams are working together on that, which is a really good sign.
And that's what integrating more and working as a system is all about. So I think that's fabulous. Carol, and then Robin.
Sorry, pressed the wrong button. Thank you. Yeah, I think that communication that Becky mentioned is so important. One sort of query and just one comment. I know the huge pressure on the ER we keep hearing about. I mean, is there a knock-on effect from the way GPs are now operating? Because from personal experience, when I've had to phone up, they are very ready to say, go to A&E. That must be impacting you enormously. And if it is, then how can it be dealt with? And the other thing is just really a comment about the maternity services in that letter. I hear what Craig is saying, and you know, it was very brave of them to do it, but there was huge sadness, I felt, that they still feel that is the only way they can get that out there. So I think there is a lot of work that still needs to be done if staff feel, you know, that they're in such desperation, that is the only way they can get listened to. But the first one, the doctor's one, I'd be very interested in any thoughts on that. Thank you.
Yeah, so Carol, so just on your second point, I absolutely agree, and we've got work to do to ensure that people feel able to share those concerns, because actually at the point at which your concerns have reached the stage where you're considering external communication, then we've probably suffered for some of those things for too long. So the easier we can make it for people to share those concerns, the more quickly we'll be able to respond. So absolutely, I agree with you. In terms of primary care, I think it's worth remembering that primary care are busier as well than they have ever been, and they are offering face-to-face appointments, but they are also offering remote consultations, and that is a way that they are finding to try and address the increased demand. What that does mean is that people will feel dissatisfied. They will feel as if they're not getting the same level of service that they were previously, and that's absolutely true. But if you come to the emergency department at the moment, you will not get the same level of service that you previously should expect because of the level of demand that we are facing. So what's not helpful for us, and there is a real temptation to do it, is to think that we're working harder than any other part of the system, and it's almost automatic to do that. But I'm absolutely convinced that social care are working harder than they ever have done before. Primary care are working harder. Mental health services that we so often ignore are absolutely deluged with demand, particularly from young people. And we're seeing the consequences of that in both acute services and the community. So I know everywhere is under pressure, so you will find areas where you are dissatisfied in all of those services, but it's not a reflection of lack of hard work.
Thank you, Craig.
May I just come back very quickly, Sheila, just to say, I don't have a problem with the telephone things. I think that is the way forward. But there are things that they would have dealt with in the past, and they're saying take it to the hospital, and that's the area. And of course, all that pressure on these lower ones is impacting on you as the end person, as it were. Yeah.
Jane, can I bring you in, please?
Thank you. Yes, just a couple of points. Would like to emphasise the messaging about managing expectations. We did talk about this at the last meeting. I was just flicking through there. It's in the minutes there. So we really do need to get those messages out to the community, I think, as quickly as possible. That was just one point backing onto what Becky said. And secondly, I was very saddened to hear about the maternity situation again and the whistleblowing. And again, we did talk previously, I think in the last meeting, about were you going to try and recruit some champions to support the Freedom to Speak Up Guardians, James and Amanda. I wondered if there'd been any progress on that, so they're not shouldering it all and staff have several avenues to go to. Thank you.
So we've appointed 40, Jane, so far.
Oh, right.
Freedom to Speak Up champions. I would say that, well, at least last time I spoke to Amanda and James, there wasn't one of those in maternity. So we still have some more work to do around making sure that we've got organisation-wide coverage. But we are successfully recruiting to those roles, and that's part of the tactic in terms of making it easier for people to speak up.
Richard, I'm going to bring you in because you have a twin hat here, both in terms of being maternity champion, but also Freedom to Speak Up champion. So in a way that all comes together around you. So Richard, would you like to comment on where we are, both in Freedom to Speak Up and in terms of how that relates to maternity?
Thank you. So in terms of Freedom to Speak Up, Amanda and James have done a fantastic job recruiting Freedom to Speak Up champions. I have attended so far 2 sessions. They have day-long training sessions for the Freedom to Speak Up champions, and they invite me to come along at tea time and have a chat with the people there. They've had 2 already. I've got another one in November. So that hopefully will make an enormous difference in terms of ensuring that freedom to speak up is not something that's sort of imposed from above, from board level, but is actually something that is understood, accepted, recognised on the shop floor, and that people see it as business as usual. There's a long way to go, but they're working very hard, and it's very impressive. In terms of maternity, I think everyone is very sad that the midwives, whoever they were, felt it was necessary to raise issues in the way that they did and didn't feel that they could do so in other ways. And clearly an awful lot of work needs to be done to change that. And I know that an awful lot of work has been done to change that. A lot of it's about communication. A lot of it's about helping the midwives to understand that they are being listened to, that there is a lot of work going on to try and improve the situation, but that some of the problems faced by midwifery are not local problems, they're national problems which require a national solution. That work is going on, and you'll see in the board papers there's a whole tranche of things that are happening to try and improve the situation in maternity and to try and improve the communication in maternity. So long way to go, but yes, an enormous amount is happening.
Thank you, Richard, very much indeed. And I'm sure we'll come back to freedom to speak up and the Guardians and Richard's role again in future meetings. It's absolutely fundamental to what we're trying to achieve at the moment. So thank you, Richard, and thank you for what you're doing on that. Okay, I don't see any other hands up. So thank you, Craig, for that, and thank you for the discussion on that. Can I move then, please, to Governor questions? Liz, this is presented by you. Was there anything you wanted to add to what's on the paper?
No, there haven't been any further questions. The only thing I would say is that Alan did research another question, which was to do with any patterns within the resignations of staff in any shape or form. And I know Alan sent a very comprehensive response, but also he said that he will be following that up and just checking on it from time to time with Jeremy. So I just wanted to clarify that one. And I'd like to thank the Neds who answered questions at our informal meetings when we held it. So thank you very much. It's always useful to have it, if not face-to-face, but, you know, face-to-face.
I know what you mean, Liz. Okay.
Yes.
Thank you very much indeed. So can we note that report then, please? And can we move to the report from the Engagement Committee? And Florence, over to you.
Evening, everybody. I totally endorse the delay in changing governance of the governors at the moment. Not only does Liz do a good job, but I think it gives such great continuity just when we need it. So I totally support that. I think the engagement notes are fairly explanatory. I just want to draw your attention to a couple of things. Quality walkabouts have recommenced, which is just the best news we've had in ages. May it continue. And I just wanted to say to new governors that the format has completely changed for the better, I have to say. The old format was a 1-hour quality engagement, which was very much led by executive staff. And I always felt a little bit, much as I enjoyed them, that the governors were kind of following in the coattails a little bit and just observing. The new quality walkabout style is a 3-hour, so it's a morning commitment with a debrief at the end. And the whole thing gave a much higher profile to the job we're doing ourselves. It gave us a much more of an active role, and I highly commend them. If you have the chance to do them, please put your names down. The second thing I want to say is that we have an engagement brainstorming afternoon with Anne and with Anna Hollis, and our engagement team members. I think most of us can be there, which is great. It is face-to-face, and we are going to be brainstorming lots of things around engagement. One of the things that we will be looking at is the whole issue of online perhaps raising the profile. How do we recruit more members? Why would we want to? How do we keep them? What inducements? And most importantly, how we go about our engagement duties with an increased sense of participation. And I think on that, I'm not going to comment greatly on the engagement community groups that met, other than to say, I have to say I was disappointed. The content was fabulous. The presentations the staff put together were absolutely terrific. My sadness was there was virtually nobody from the public there to see them. And in fact, one of the ones I was at was cancelled. I said to them, you know, there was only me there. And I said, to take two of you out of work to do a presentation for me is ridiculous. But the presentations were brilliant. And we particularly spoke to the people doing the pathology and mortuary one to actually suggest that we bring that to governors at some point, because the presentation was so illuminating, particularly around the whole area of pathology, which is a huge issue anyway. So our brainstorming is on the 25th of October. I've already had feedback from two governors, interesting points to raise. I was at an NH recently where lots of fresh ideas came in. Some I thought were great and some I slightly questioned, and I think Anne would probably as well, but we will bring these up and really look at them on the 25th. So can I, I'd love to get more feedback from governors between now and then so that we can discuss this, because we are there to represent everybody. We're not there as a little decision-making squad. We're there as governors. So fire away at me or via George if you're more comfortable. Suggestions, thoughts, whatever for future engagement, however radical they might seem. I'd absolutely love to have them, and have them for the 25th, preferably a few days before, so that I can bring them up. It was disappointing there was a low take up by governors, I have to say, on the community engagement ones, but I think the format does need looking at, because brilliant presentations just didn't hit the spot because we, for whatever reason, the public weren't really there. So really the rest is explanatory. I really encourage you to read the comments on the community groups though, because some of the governors gave quite in-depth things and very interesting. Thanks, Sheila.
Thank you very much indeed, Florence, and thank you for all the work the committee is doing. I think it's hugely important, and I think the quality walkabouts are just so much richer, they go much deeper, and they give much more opportunity to engage of staff. To me, that they are more meaningful. So I would encourage governors, as we manage to do more of those, if you're available and willing to come in, they are very well worthwhile and will really give you some insight. Brilliant to hear too you're engaging the membership more, because I think that's been a real struggle over the last 18 months, inevitably, the way we're working. So that's great news as well. I can't see any hands up, so thank you, Florence. Thank you to the rest of the committee for all the work you're putting in, and I look forward to some amazing output from the work to come. So thank you for that. We've got the draft minutes attached. Unless you want to comment on those in any way, Florence, we'll take those as read. Okay, thank you very much indeed. I'm aware we're moving to the Governor Review. Thank you, Anne.
Yeah, and thank you very much to the governors as well. I don't think I've ever had such a strong response to a self-assessment survey, with 23 out of 25 governors responding. And I think that's just an indication of how engaged you are and how keen you are to address some of the issues and the frustrations that I'm very, very aware that you've been going through, especially as a fairly new Council of Governors joining during a pandemic, with all the lockdowns and everything else that that's happened in the last year. The the overwhelming message that I had from this was we need more strategic discussions between the Council of Governors and the Board of Directors. And whilst I mean there was one of the most critical responses was how involved you as governors feel with the development of the trust strategy. This is not about the 5-year strategy that's being shared with you tonight, but this is about the big strategic discussions about what are we doing to recover from COVID, what are we doing, more conversations about things like the future hospitals and the direction that we want to take the trust in. So I think my next paper will cover some of those points. I think also the other theme that I picked up from this was that we need to communicate more with the Council of Governors, and that the flow of communication between the board and the Council of Governors needs to be improved. And again, I see that as very much part of the role of the trust secretary in making sure that you're talking about the right things, that you're having the right forums for those discussions, that you have the right work programme going forward. I don't think there's much more that I want to say about that. I mean, I shared the highlights with you at the away day. This is the results of the survey in full, because I know nearly everybody who's spoken to me on it have wanted to see everything on all the comments, and here it is. So happy to take any questions.
Thank you very much indeed, Anne, and thank you for organising it, and thank you all for your feedback. Is there anybody who wants to pick up a question? It may be that we move to, because in some ways your work programme forms part of the response to that, because it identifies where we're not spending enough time, for example, on big strategic issues. And I mean, Roy, you raised in writing to me and to others the issue about the system working and the ICSs. I mean, these are big issues for any organisation, how we work in a new way with a system, and we've talked about the future system work tonight. So I think there are some really big meaty issues like that we need to dedicate some time to. And I think, Anne, what you've done is you've taken quite a number of those big issues and worked them in with the statutory requirements of the governors, but also the things that we need to be talking about for us, for our communities. I'd rather use the word communities and patients, because I think it's not just our current people who are ill, it's much wider than that. So if there are no other comments at this stage, what I'd like to move into is the work programme, and then I'm happy to pick up more general points from that. Okay, so Anne, do you want to move straight on to the work programme?
Yes, again, I did feel coming in when I did and looking at how things worked during the pandemic, that governance in many ways was pared down during the pandemic, and the work of the Council of Governors was one of the casualties of that, which was been incredibly difficult, especially for brand new governors who possibly didn't understand why this was the case and felt marginalised and left out. But the governors still have a very important role to play. And I thought by putting a structured work programme together, which made sure that we didn't miss out on any of the really important statutory duties and covered the big strategic issues, that this would be a step in the right direction. I'm aware that there is a big gap in the work programme that I put together relating to membership and engagement, and that's my third strand, which, as Florence mentioned, we will be tackling that in the next couple of weeks, and hopefully at the end of that process I'll be able to present the third bit, which is the membership and engagement work programme for the future as well. there's a lot of information there about the statutory duties, because I think it's really important to understand where we're coming from in terms of why are we doing some of these things. So please treat this report as a bit of a reference document, if you like. I mean, I don't expect you to read it, memorize it, and answer any questions on it. But to just refer to it if you've got any queries about why governors look at particular things. And then the last bit is the strategic work programme, which is indicative, and we'll probably not do it in the order that I've presented it there, but those are some of the subject areas that I think we need to have those sessions, those seminars, those workshops, whatever you want to call them, going forward. So happy to take any questions.
Okay, I'll open it up for questions. But before I do, can I thank you for what is a huge piece of work and has brought a real coherence to what we do and when we do it and how we do it. I think it's a hugely valuable piece of work, and I'm very grateful. Liz, can I bring you in?
This is really a typo, Anne, more than anything, because in your first statement it says that we were appointed in November 2021.
Right, okay, 2020, wasn't it? Yeah.
It's just, I presume this is a public document, so it would be useful. The other thing I don't know whether it appears here or in the audit is, and Becky will remember this probably because she was present at the very first training we had. We were informed of our duties when it came to large payments. You know, this, if there's to be any large transaction. Now, I have to say, in the years I've been there, not once have the governors ever been asked to agree or sanction or whatever. This could be that nothing big has ever happened, but I think that in your reviewing of our statutory duties, it's one of those things, that it would be good just to clarify, to make sure that we are adhering to our duties and that these things are being presented to us and not just kept back and rubber stamped.
Yeah. I think that's the reason why the governor engagement with the forward plan is so important, because in the forward plan, these really big things would be pretty high up in the list of what's going to happen next. Absolutely, I'm convinced that the reason you haven't had any votes on any of these big issues is because they haven't arisen. And in all my time as a trust secretary, we had a merger in SNF, and that's the biggest thing I've ever dealt with. And I can't think of anything else, not even sort of an increase in the percentage of private work, because that's another thing that comes to the council as well. But no, this is something that I do keep a very careful eye on, and they are very few and far between in all organisations.
Yeah, thank you. It's just to keep us on our toes.
Yeah.
Okay. Alan, thank you. There's a message in the chat which he can confirm that there's been no big transitions in the last 5 years. And I think just something that occurs to me that we ought to touch on as part of the work programme, and probably under the work of the system and the ICS, because actually there will be governor duties which become, I was going to say compromised, but will need to be thought about as we work more on a system basis. Mm-hmm. I know there is a very wide issue about governors and their role, but let's just keep that thought in our mind, because I think it's one of the real challenges for a governing body moving forward. Okay, thank you. Are there any other questions? In which case, are you happy to approve the work programme? I think most of you would welcome it as well as approve it. So thank you, Anne, for that. And I note that the Constitution Committee is one of the early work groups that you want to set up. And I think that's really important.
And we have got Sarah Judge, Thomas Pullimud and Clive Wilson joining the Constitution Committee for the Council of Governors. We will also have 2 directors on that committee as well.
Excellent. Thank you. In which case, I'm going to move on to the summary quality and performance report. Jude, you're presenting, but Helen, we've got you here as well. I'm very conscious. I would like to take the report as read, but I'm quite sure, I'll turn to Jude first, but then I'm sure, Helen, you will want to add some colour and flavour to this.
Okay, thank you, Sheila, and good evening, everyone, again. First of all, thanks to Helen and Susan, who've done all the hard work in preparing the report. And as Sheila said, I will take it as read and throw it open to questions very shortly. But if you would indulge me, perhaps in just, I'd like to share some thoughts on two themes I think that occur to me when I read this report. And the first is nothing new, but that doesn't mean it's any less significant or important. And it comes under the heading of continued pressure on staffing. We see that obviously in the nurse staffing figures, but not just there. I'll come on to that in a minute. Clearly, this is not just a West Suffolk issue. This is a system-wide issue. I don't have the comparative numbers to hand, but I suspect if we look at vacancy levels in some of our neighbouring trusts, they're likely, in fact, to be higher. I remember when I was at Colchester, we were lucky if we ever got below single-digit vacancies. In fact, most periods we were operating at least 50% higher than the numbers in this report. However, it's a system-wide pressure. It doesn't make it any easier for us. And I think what was really important to me was something that in Craig's report, but perhaps he didn't actually touch on in any great detail, but that's the level of support we're providing to staff, because as he mentioned, with demand, with staffing not at capacity, then clearly there are significant pressures, and we can see that as well coming through on some of the red flags in maternity, which I'm sure Helen can deal with in more detail. The second area I'd just like to touch on is what I see as some progress on learning from mistakes, learning from serious incidents, and that's referred to under the PSERF, which is quite a tricky little acronym, but it's the framework that's being used by the trust. And as the report says, they were the trust is an early adopter of the framework, but has also been reviewed in light of the first 6 months of operation. And from what I see from the improvement committee, whilst I wouldn't say that the framework is now embedded in the sense that we would like it to be, it's certainly being operated to a much better degree than at the start of the programme. It's leading to some really good plans to address these issues, and that's one of the things I'll come on to in the improvement report in the next section. So there's real progress there, and I think it's important that you governors can understand that, because clearly it's a fundamental part of our overall governance and assurance structure. So those are the two things I'd just like to highlight. Helen, I'm sure I've missed a lot out of that, but over to you now.
Thank you very much, Jude. To be perfectly honest, Sheila, Craig talked about it a lot in his report. Jude has just picked up on it. I think the key message I think I would like to get across is that level of pressure across clinical and operational staff. I have to say, I think our patient flow team, who are the people who manage to try to find beds for patients coming through the emergency department, have probably got the worst job in the hospital just at the moment. The pressure on that team is incredible, and they do it with a smile day in, day out. So I think the difference is that we are trying to do all of this whilst rebuilding the hospital around ourselves. So we're doing it in the middle of the building site. It is not uncommon for me to say to external people, there's more builders on the corridors than there are nurses if you walk up and down the corridors, and sometimes that feels like it's the case. Now that could be the case because the nurses are on the wards looking after patients, but nonetheless it has become a real feature, and the extra pressure for us, Craig alluded to, working in different environments, coping with what is a very uncertain situation because the decamp programme is very complex. We are leading the way in terms of that, and I mean that nationally. Work that is being done at West Suffolk is being taken forward as regional and national exemplar best practice. But of course, as we learn from what we do, that means that often we have to change our approach and change our plans. And that's really tricky for the staff because they want to know what the plan is. If we really tell them a lot of detail of the plan and it changes, that's unsettling. And if we don't tell people what the plan is, that's unsettling too. So it's a really tightrope fine line that we manage there. But what I would say is, it is incredible to me. When we started this, we really thought there would be mutual aid from other trusts and partners across the system because we thought we would be in a worse position than anybody else. Now, our elective recovery programme is absolutely impacted because of the theatre closure at the moment. But in terms of emergency flows into our organisation, we are holding our own across the region with everybody else, even notwithstanding the capacity that we have got closed. And that's absolutely a testament to the hard work that people are doing. We do often reach out for mutual aid, but they reach out to us too. And more often than not, we're in an equivalent or a better position. So the cavalry is not coming over the hill, and that's a challenge to us. But other than that, to be honest, I do take the report as read, and therefore I think it's probably a better use of my time with the governors to answer direct questions rather than me tell you what I think you want to know. So I'm very, very happy to answer any questions that you've got, or try to.
Thank you, Helen. Are there any questions from governors? I think your report has so much detail in it, and also, I mean, I know that many other governors who are in the room tonight are regular attendees at board, and so see your board reports. And I think it's really important because that gives you the opportunity to follow the progress around this performance agenda.
If there are no questions, Sheila, then let me just take another minute. I was sure somebody was going to ask me about elective recovery. So let me just give you a little flavour of our position. So the rack plank decant programme has resulted in us only having 40% of our theatre capacity from June to December of this year. And that 40% is largely taken up with a trauma theatre, an emergency theatre, an obstetric theatre, and then there are 2 elective theatres. And that means really we have had to focus our attention on the highest clinical priority of patients. We have used the Vanguard, but it has had limited use for us. But we are working really, really collaboratively across ESNEFT in order to address some of those issues. So by December, we will have 80% of our theatre capacity back. By February, we'll have 100%. And by March 2021, we will actually have 120% of our previous theatre capacity because we'll have brought Theatre 1 online. The teams have worked really, really hard to increase utilisation in day surgery as well. So the modelling that we have done looking forward suggests that by the time we get into the new financial year, we'll have about 130% of the previous capacity. That all sounds really positive. However, we will by then, and already have, a massive backlog. And so some of the things we're doing is working collaboratively with the BMI on a contract with them to increase joint replacement surgery. We've already transferred some activity to Ipswich for ENT and ophthalmology, and we're in discussion with them at the moment to transfer some trauma and orthopaedic cases, all absolutely with the patient's consent, but recognising that because they haven't got this challenge, their waiting times are considerably shorter than ours. And we are offering to move patients to get their treatment sooner through that particular route. And we're working hard on those measures as well. So it's going to take us a while to dig out of this position, but I want to assure governors that the clinical and operational teams are working really, really hard on plans to do that as soon as we've got the capacity back online.
And I think, I'm just looking at Anne, we have scheduled in a session on recovery as part of the governor work plan. And I think that's really important because this is such a big issue. And I know it's one that people in the community will be bringing to you because, you know, we know we are not treating patients at the speed at which we would choose to do. And well, patients are being willing to go elsewhere. There are a certain number that are very unwilling to travel further. So part of our job at the moment is persuasion. Helen, thank you very much indeed for that. And thank you for the detail. And Helen, I'm very conscious that this is probably the last time you'll attend a COG meeting, although we will try and get a session on recovery in before you go, just to make sure you do. But in case this is your last opportunity to appear at the Council of Governors, can I start the trail of thanks, which undoubtedly will last for the next month. Helen has been an absolute stalwart in the West Suffolk team. You will be enormously missed, and although we welcome Nicola into the new role, you and your presence and your straightforward honesty about how things are, I think is something that governor colleagues who've known you for a long while have hugely valued. I will certainly miss you as part of the team. The team will miss you, the executive team will miss you, I know, but I know that those governors who know you and have had the opportunity to work with you would wish you all the best for the future. And thank you for everything you've done. Your experience, safe pair of hands, has been so valuable.
Thank you, Sheila.
I'm afraid, Helen, I should be saying a lot of farewells to you, but each one of them is very hard and very, very much meant. So thank you, Helen. Are you staying for the rest of the meeting, Helen? I am happy to stay in and pick up any queries or questions. We're happy if you do, but if you wish to slip away, I'm sure governors would forgive you. Okay, thank you. Can I then move on, please, from that report? And can I move to the Finance and Workforce report, which again will take as read. Now, unfortunately, Chris Lawrence has had to leave us for another meeting. So, Craig, I'm going to hand to you tonight, if I may. I think we can take the report as read, but if there's anything you want to highlight, do.
Thanks, Sheila. God, this feels like being back home. So the finance report, as governors are aware, we are breaking even. The report you've got in front of you is up till the end of August. It will be the same numbers that broadly appear at the end of September. So we will break even for the first half of the year. You'll remember that we entered the year with a plan for a £10 million, and following the submission of the plan, our income got adjusted centrally. And for the first half of the year, our income was increased to the level of our planned expenditure. For the second half of the year, we've recently had notification that our income is going to go back down. So our expectations now are that we will make half of that planned £10 million deficit. I would say that there is still a degree of uncertainty, not about our expenditure levels, where we're very good at forecasting what our expenditure will be, but our income, although we have had notification, we believe it is still subject to change. However, as we sit here today, our plan is now to make a £5 million deficit for the second half of the year. As Sheila said, happy to take the rest of the report as read, and I will try desperately to answer any questions you may have, but I may be stretching a bit.
I doubt it, Craig. You're not that long out of the role. Liz.
It's just a quick question, Craig. Are we being given any support for the rack plank issue? You may have said this before, so forgive me, but so many things keep cropping up. But are hospitals being given support for this? Because it's sort of almost like an unexpected, very big expense.
We are, Liz. So there's two ways in which we're being supported. Firstly, in respect of capital, so there's 110 million has been allocated nationally to deal with RAC, and of that 110 million, West Suffolk are getting 30 million, so we're getting more than a quarter of the national total, and that reflects exactly what Helen was describing earlier in terms of our understanding being further ahead than most other organisations. There's also a revenue impact. So again, as Helen described, our ability to deliver elective activity in particular is constrained by some of the work we're doing around RAC. And so in terms of the way our income is calculated, it has reduced the amount of elective activity that we need to do in order to earn the income that we should expect to receive. So in two ways, we are benefiting from central support around RAC.
Thank you.
Thank you. If there's no other questions, then can I thank you for stepping back, Craig, so to speak. That's much appreciated. Unless anybody else wishes to contribute to that, I'm going to move on, please, to the 3I committees. And again, I'm going to suggest the papers as they stand are taken as they are, but I'm going to ask each of the chairs if they have things they would particularly like to highlight. Richard, you're, I think, first on the list. So from the Insight Committee point of view, is there anything you would wish to highlight with the governors before I open it up for questions?
Thank you. Just two quick comments. First is that we've actually had a second meeting since the report you've had. That report was too late to get to these papers, but is in the open board papers for the end of the week. So some of you may have read that already. Just in general terms, my feeling is that the Insight Committee is beginning to work extremely well. All of the subcommittees feeding into it have met and are working effectively. We had somebody from Integrated Development at our last meeting. I don't know if it was Chris, because they snuck in and snuck out again. I didn't know who it was. But from my perspective, we'll get some feedback in time from them, no doubt. I think things are beginning to work very well, and happy to answer questions.
Thank you very much indeed. I will ask if there's anything to raise on Insight. It's good to hear, because I think, Richard, you've taken on the challenge of probably the most complex of the committees. Not that I'm in any way implying that the others aren't doing a fabulous job, but I think yours was the one where there was the most complexity, particularly around the committees feeding in. Helen, you wanted to come in.
So just a quick note to add, because I know it's something that exercises the board and sometimes is a concern for governors. So since the last meeting, I've managed to have a meeting of all of the relevant people around community metrics, and we are now establishing a very specific committee or subgroup under the Insight Committee that will consider all of the various community metrics. So hopefully that's the final piece of the Insight puzzle that people will be pleased to hear about.
Thank you, Helen, and that's fabulous, because in all my years in the NHS, community and metrics have always been an issue, because though they do a fabulous job, it's not easy to actually count, or, well, we tended to count beans, so to speak, rather than the things that really matter and make a difference to patients. So I think understanding that metrics will help us in all sorts of ways moving forward, you know, to have more depth of understanding. Okay, thank you very much indeed. If there are no other questions, then Jude, could I move to the Improvement Committee? And thank you for taking the challenge of chairing that committee on.
All right. Yeah, thank you, Sheila. I'll follow Richard's lead. I'll take the CK as read. Just to put a little context around it, as Sheila mentioned, the notes here refer to the first meeting I chaired, and I think only my second meeting, which I attended. So I'm sort of getting my feet under the table and sort of learning as I go along. So hopefully I'll get better over time. Who knows? I think as far as our committee is concerned, I think we are still just a little bit finding our feet. And one of our key tasks, in a way, is how do we improve the Improvement Committee? Because we're constantly asking that question. We're constantly going back to some very onerous responsibilities. If any of you have had a chance to look at our terms of reference, they really are quite frightening if you look at them in the cold light of day. So we're constantly asking ourselves as a committee, are we doing what we're meant to, what we are set out to do? How can we improve? And in particular, how can we make sure the flow of information is coming from the correct sources? So when this meeting, which was on the 13th of September, when it happened, only one of the subcommittees that feeds into our Improvement Committee had actually met. So now both have met, but again, they're in their relative infancy. So as a system, we're just trying to work out how we get that flow. When issues arise, as the ones that are noted here, how often do we review them? Is it monthly? Is it quarterly? What's the appropriate time? So all of these things we're working through at the moment. However, there is a proper feed. We understand where the issues are arising, how they're arising. We're confident that at the management level, adequate plans are being prepared to address the issues that are being raised. And one of our jobs, along with the management assurance committees, is to ensure that those plans are effective, they're being carried out, and in the case of actions which need to be embedded in the organisation, that is happening. So we're looking at all those aspects. So anyway, that just giving you a little bit of context, but happy to take any questions on the specific points in the report.
Thank you, Jude. And I think that flow of information, or the timing for flows of information, is such a crucial issue, because for us collectively as a board, we need to have the assurance of that flow upwards to the board, and that you are operating, that the committees are operating as proper assurance committees and not as operational committees. So that's good to hear that the committee itself is reflecting on that. And we will need to reflect on that as a board in terms of what flows up to us. And I think it's part of the work you're doing around timing of meetings and the flow of information in all senses. I'll happily take any questions. If there aren't any currently, then I will move to Alan. Alan, Involvement Committee. Could I pick up the Involvement Committee with you?
Yep. Good evening, everybody. Like the others, I'd like to just remind you of what this committee is supposed to be about, because it's sometimes the hardest to understand. There's not a lot of data about it. It's really about giving the board assurance that we are involving and engaging the people we serve in the way we care for them. And that means the patients and the public. It means our workforce and the system around us. So our job is to make sure that we're satisfying all three of those constituencies, really, in feeling involved and engaged in what this trust is doing. And I'm going to draw attention to three of the items on the summary there. The first one is about a toolkit, which sounds very sort of technical, and one of our team, James McFarlane, is looking into this. But it's basically saying we need to embed involving people in every change that happens in this trust. And we know that that hasn't always been the case in the past. Sometimes we've done it really well in the way that Gary's working hard on with the future system. Sometimes we haven't. And what we want to do from an assurance point of view is to say, let's embed this way of thinking in everything that we do, even if it's a small change about the colour of the walls, something mundane. Let's think about that smartly and think, are we involving the right people in that? Doesn't mean involving everybody in everything, so we have to be careful of that. Let's make sure that's an embedded, instinctive part of our culture. We're not there yet, but we're going to have a toolkit which will try and do that. The third item is one you're already aware of, which is to involve you as governors a little bit more. And that's the proposal which we're looking for your approval of today, which is to have a member of the governing body as a regular member of this committee. That's to recognise the fact that you've got a key role in member and community engagement, and we're hearing more about that all the time through Florence and the team. But it's also a way in which that governor, as a representative of you, can actually hear about all the other things going on in involvement in terms of the assurance we're getting. And so I'm looking forward to hearing about who that's going to be on our committee. Just so you're aware, Liz and the team, the next meeting is on Monday, the 15th of November. So we'd like to make sure a governor comes at 1:30 on the 15th of November. The fourth item on the list is the one that Craig's already alluded to, the maternity whistleblowing. As Craig said so sensitively and eloquently, we want people to raise concerns. We're trying to make as many channels as possible for them to do it. And we have to recognise that sometimes it might lead to whistleblowing. Ideally, that wouldn't be the case. Ideally, our channels will be fluid and open and honest and comfortable for people, that it doesn't reach that stage. But Jeremy is going to lead on this with the board and make sure that this particular episode, if you like, so that we're helping to lubricate the way people raise concerns early in the process, if you like, but also if it does reach this more extreme situation, we actually learn from that too. Have we learned from this episode? Can we do it even better in the future? So it's to give you some assurance that that is being thought about, led by Jeremy on behalf of the board. So otherwise, happy to take any questions about the work of this committee.
Thank you very much indeed, Alan. And I welcome the work you're doing, and it's really interesting. There's threads have run through tonight's meeting, from Florence's report to your involvement committee report. You know, there are common threads running through, and that feels good because it feels about learning, it feels about listening, feels about moving forward. If there are no questions, we will take it as read. Thank you, Alan, and thank you to all three of the chairs. I'm going to move to the future systems update. And at this point, we've covered quite a lot to do with future systems. Is there anything anybody else wants to add to that? Craig, I think if there is anything additional, you probably are the person to pick it up. I see no hands up at the moment, and we've clearly got a session next week talking about the clinical model. So that will be an opportunity to look at future systems again. Thank you for that. Which case we move to the annual report and accounts. Anne, I think this is your territory as company secretary.
It's already been received by the Council of Governors, so this is just a reminder of the link for the governors to read the annual report and to reflect on its contents.
Thank you very much indeed, Anne. I cannot see any hands raised, so thank you for the work you've done. And I will move on then to the trust strategy. And Craig, we've touched on the strategy a number of times, but I will leave you to speak to the report.
Thank you, Sheila. So what the report report aims to do is to update governors on the level and the detail of the engagement activity that has taken place since the last meeting. So we have sought views on the trust strategy from a wide number of people across the organisation, and hopefully incorporated that into those views into the strategy where appropriate. The most significant development since the last governors meeting is around the metrics. So we've done a lot of work with a wide variety of staff to come up with appropriate targets and appropriate metrics that detail that will demonstrate to us whether we have made progress and whether we have achieved the targets that are contained within the strategy. So I wasn't proposing to go again through the strategy in detail, but very happy to answer any questions on this. It feels like it's a document that is really coming together and will be useful within the organisation in terms of providing a context within which we make decisions, and that is the most useful aspect of any strategy document. It allows you to effectively prioritise, and when we've spent a lot of this meeting talking about pressures, then one of the ways in which you deal with pressure is to prioritise. That does mean letting some things go, and how you make those decisions is governed by the strategy, and hopefully the document that you've got in front of you will help illustrate that.
Thank you, Craig. Liz, can I bring you in, please?
Yeah, it's just an observation, Craig, and it may be just me not seeing this quite as it should be, but in the chart, our successes and challenges, I don't know whether it's right, but this review we've been waiting for, which I don't want to go into any more detail, doesn't appear there. And I sometimes think that might be one of our biggest challenges, because you're saying about pressure, but when we come to have that review, we have to work on it, it will be, I know we've been ongoing with it, but it just doesn't appear in that timeline. So I was just raising it as a thought.
And I think it's a fair point, Liz. The success and challenges, the document is looking backwards. So it does look at the last 5 years, and obviously we haven't yet received that. The issue is at the point at which strategy starts to be socialised within the organisation, we may well have received it, and I entirely accept your point. It is somewhat significant for the organisation. So we'll look at how we incorporate that. Thank you.
Thank you, Liz, for raising that, an important point. But it will be important too, we don't lose sight of the moving forward. That's good, thank you. There's been a huge amount of work go into this and a lot of engagement. And I do take Craig's point, strategies shouldn't be sitting on a shelf gathering dust. They have to truly inform and drive what you are trying to achieve. Thank you. Well, in which case, can we move to the nominations committee? It seems rather a long time ago when we met. It was actually, so this is a little bit historic. I intend to take it as read. I will just comment, we have a nominations committee coming up shortly and a number of issues to discuss there. But if there are no questions, I'm more than happy to take some. Okay, thank you. In which case we'll move to the League Governor report. Liz, this is your report. I don't know if there's anything you would like to highlight.
Not really. Obviously, it's quite clear. I would like to say that thank you on behalf of the governors for giving us the opportunity, giving me the opportunity to speak on behalf of the governors at the annual members meeting, which I think, being the first that we'd had in that way, was a good way of governors being seen as, being part of the triad within the trust. And I hope the governors felt that I represented everything that we'd done during the past year. I would like to say thank you to all the governors who attend all the meetings, informal meetings, which are really quite hard sometimes, getting making sure everybody is there. I'd like to thank Florence, who, as my deputy, comes in and says, hand up by so-and-so because I can't see it or whatever. So thank you, Florence. And we do meet regularly, Florence and I do, to update. And so really that's it. And thank you to the Trust for giving us the opportunity of having our boosters. I feel it is important if we want to carry on the 15 steps quality walkabouts, the face-to-face, that we do, you know, take up the option of having our booster jabs as well. And the other thing about the 15 steps, I've got a meeting tomorrow, and one of the things I'm bringing up is how we feed back to all the governors on what happens during those walkabouts, not just those that attend. So I think that's all I want to say. I hope I've been brief enough. Thank you.
Thank you very much indeed, Liz, and thank you for all you do. And I must say, you know, I've worked on a number of councillor governors, and I think, you know, we're very lucky to have you. So thank you. If we could then move on, please, to the staff governor report. And Martin, I believe you are presenting if you are here.
Hi, I'm here. Yes. First of all, to say we have carried on meeting sort of regularly. The last few meetings with Liz attending, which is very nice. So the rest of the governors can have an idea of what we're actually talking about. Our last meeting was just last week, so my apologies that we haven't had time to actually write a report for you. But it will come as no surprise to anyone, given what we've discussed in the rest of this meeting, that the majority of that meeting was spent discussing the sort of unhappiness and uncertainty of the staff and what we as staff governors might do to help them understand us and us understand them. That's essentially. I just raised one interesting observation that we actually discussed, which we should bear in mind, that whistleblowing tends to beget whistleblowing. And if we have a severely critical report, then the staff may start criticising each other and ourselves. That's part of what we've got to deal with. That's all I really needed to say.
Thank you for that, Martin. Are there any questions for Martin? Okay, thank you all very much. And thank you for managing to keep meeting, even if it was irregularly, through a time when I'm quite sure all of you were extraordinarily busy. And I know that, Liz, it's really helpful to have your input to it and to provide the connection back to the main group of governors. So thank you. Alan.
Yeah, I throw a question back to Martin, really, which is, you've talked about the unhappiness of staff. What do you think the relationship should be between you as staff governors and the big network of freedom to speak up champions that we've got now? Do you have sort of access to them and them to you to help sort of socialise those issues?
Absolutely, that's one of the issues we've been discussing. And the freedom to speak up days that they've been having, they've actually asked the staff governor to go to each one of those as well. So we are trying to be just another pillar of the whole sort of building of different ways of staff feeding back. But we definitely are wanting to be part of that system.
Thank you, that's good.
And certainly staff have, in the past, in my experience, have gone to staff governors when there are issues that need to be brought forward and act as that conduit, which I think has been hugely valuable. Okay, thank you for that. In which case, we have managed to get ourselves back on time, which is quite amazing. You have the dates for the next meeting, which I'm sure you've noted in your diary. I would like to think it might be face-to-face and that we would be able to celebrate Christmas. But I think that may not happen, but we will. I mean, we've had a plea already this evening about meeting face-to-face, and I'm absolutely committed to it if we can do it safely and it's appropriate. But we have to remember we are seen as a role model for the NHS. And so it does matter that we behave in an appropriately measured way, but it would be nice to think we can, and when we can do face-to-face, we absolutely will. And I would like to give public thanks to the local authorities and to the college, who have both been very cooperative about the potential of meeting in their large spaces, and that would be a possibility for the future. So I will keep on that one. Can I just turn to the last item then, reflections on the meeting? Any feedback, please, other than that you wish it had been face to face, because we'll take that as read. Okay, it's been a very dense meeting, and I'm conscious when it's that busy, it's quite hard to get into depth in things. But hopefully with the new work programme, that will enable us to have some proper time together to explore those issues. So thank you all very, very much for your attendance. Can I thank Liz again as lead governor? Can I thank Helen for everything she's done over such a long period? And I mean it very sincerely. We are all going to miss you very much. But can I thank you all for the work you do? Because I can't ever think of a group of governors who have been so great at attending meetings, at participating, at providing challenge. You know, and I've known a number of groups of governors over the years, and you are the most participative I think I've ever worked with. So thank you all very much. I'm in the days gone by, I would have said safe journey home. I'm afraid it's safe journey now to your kitchen or wherever you happen to be heading. So thank you all and good night.
Bye.